You just have to have the willpower to do it and then tell yourself in your head, I'm gonna do this. I'm gonna make myself better and I'm gonna be there for my family. I've had diabetes for at least a good 20 years. And my dad had it, my grandmother had it, and my mom has it. My brother has it. My grandmother was having to take shots, and I swore up and down, because I was younger when I lived with her. I said, I'm never gonna have to take shots. And then when I come to Great Lakes Bay and I found out I had to, I was remembering my grandma having to do it. I was like, I don't wanna be like this. So I said, I've gotta do something. I've gotta change what I'm doing so that I can be better off and be here for my kids, be here for my nieces, nephews, and grandkids.
My name is Terry Cerazio. I'm a registered nurse here at Great Lakes Bay Thumb, and I am a care manager and a staff nurse. Nancy is a patient for me that stood out and was eager to learn. When we got her a Dexcom, she started to watch the numbers for diabetes and what her sugar was doing, and focused on what the food was she was putting into her body. And I started to see a really positive change. And she said to me, Terry, I want to get off shots. I don't want to give myself shots anymore. And slowly it was, okay, get rid of the shots. And another oral med was discontinued. The weight started coming off. She was setting little goals and meeting them. And it was just a transformation. When she came in, I saw the smile started getting bigger and bigger, and the body was getting smaller, and the clothes were getting looser. She was determined to get her diabetes under control. Her A1C stopped, her weight was coming down. And I said, you're an inspiration for others.
I've learned that just pushing yourself to where you lose the weight and you're happy with yourself, you're gonna make it to where you're here to see others grow. That's one reason why I'm here, to help people that are in the same situation I am.
Knowledgeable, patient, comforting, non-judgmental. All those things matter. They matter to me, and I'm sure they matter to many people in this community. It's just all around a whole health atmosphere. They take care of your whole health. And if you got questions, they answer. And then they ask you if you have more questions. They dig deeper, and that's what I like. In 2018, I got admitted into the hospital, and they couldn't figure out how fluid was getting into my lungs because of my age, and they just thought it was pneumonia. I started seeing Dr. Koner. She started finding things that no other doctor could find. Dr. Koner took the time out of her day to really look into what was going on with me. If she didn't know, she found out somehow, but she took that effort, the extra effort, with me not even around, not even in the room. She took it upon herself to figure out what was going on with me. Dr. Koner supported me physically and mentally through 4 open heart surgeries and a stroke. As a child, I had strep throat that developed into rheumatic fever. As you grow older, if it's untreated with antibiotics, it starts eating away at the calcium in your heart valves. They thought the liquid in my lung was developed because of pneumonia, and that wasn't the case all these years. It was my heart failing. It was May 30th of 2024. I had my first open heart surgery. I ended up having to have 3 more because of the surgeon's mistake. I ended up having a stroke during my 4th open heart. Thank goodness I was on the operating table because they were able to address it immediately. Dr. Conroe made sure they were on supporting me and watching over me, and she made sure that I was still around. A lot of scary things that I've been through. I didn't get home till the end of February because I had to learn how to walk again. May of 2025 was my last hospital visit. I was having kidney failure, and I'm just happy to be alive today.
I had high cholesterol, high blood pressure, and my heart was not that good. So they took a scope and went up my arm and looked at my heart. I had 3 arteries plugged, and my main valve artery was closing off because of all the cholesterol. They cleaned it all on out, put some stents in there, and I'd been great since.
Well, Brent listened to what we were saying and what we wanted to work on. My main one was my diabetes. I wanted to get that under control so I wouldn't have problems. Brent did my insulin first. That way it would level my sugars out. And the more he helped me get those under control, the better I felt.
So in 2017, that's when I met Kathy and Tim. They were referred from Brent, and my job was to follow up with them every month. I did see there was some barriers that they were dealing with.
We were living in a little camping trailer, and we didn't have no income. We had nothing. And we finally met Dawn, and she seen what we were dealing with, and then she started helping us.
They worked hard at it, and we worked together. She took care of the medical part, and I did the social barriers, and it worked well. It was a good team, which I called as a dream team.
Coming here really did give me a change in my mind, and with the staff here, they really want to sit there and talk to you, make sure you're understanding your medications and different things that you can do to help get off of medication. It's just been a real big help knowing that other people are behind you.
No doctor I've ever met has made me a priority. She made me a priority when she didn't have to.
Because they care about the patients at Bayside, and they take pride in helping them with what they need help with.
Medical care here is excellent. You got everything in one building.